Hi, this is Dr. David I. Minkoff, LifeWorks Wellness Center, Clearwater, Florida. The topic I'd like to address in this video is the subject of scars. Now, why would I be talking about scars? Everybody has them. They fall down, they get cut, they might get stitched, people have operations. Well, what we find when we look at our autonomic nervous system testing, at our nutritional response testing, is that oftentimes a scar may have an effect other than where the scar was. So for example, I had a patient who had a gallbladder operation. And several months after the gallbladder operation, she started complaining about hip pain. Well, when her doctor checked out her hip, he found that her hip was normal. It had good range of motion, it had a normal x-ray, and he could not find anything wrong with her hip. And he prescribed her some kind of NSAID or something that she should take in order to modify her pain, and that she should not walk on it and put hot compresses on it, and he couldn't find anything. Well, when she came in here, we took a look at her, and using our nutritional response testing, we found that the scar itself was causing a sympathetic response. It was causing a weak muscle response when we tested it. And when we checked the body parts that it was affecting, we found that it was affecting the hip on the same side. And so we made an intervention, which is something I learned from some German doctors, where if you inject a natural local anesthetic called procaine into the scar with a homeopathic remedy called Traumeel, and this is done very superficially with a very tiny needle. It's a little bit painful, but not bad. So I treated her gallbladder scar by injecting a little bit of this procaine with Traumeel into the scar. We found that within 1 or 2 days, her hip pain was gone, that she had no more hip pain. Now this was a reflex response. This was a pain that was related to the scar, which she was feeling in her hip, but it was caused by the scar. Now sometimes scars can do funny things. I had another lady who had had part of her colon removed for colon cancer, and she had a big scar on her abdomen. Since the part of her colon was removed, she had had chronic severe diarrhea to the point where she couldn't leave her house. She would have diarrhea 25 to 30 times a day. Now she was seeing a gastroenterologist who was very competent, and the surgeon who did the surgery. They could not get her enough remedies to slow down her diarrhea so that she could leave the house, and she had been housebound for about 2 years. She came in here, we examined her. Using the nutritional response testing, I discovered that her scar was active, that the scar itself was causing her body a stressful reaction because the body was unable to get nerve impulses through where the scar was. So I took a while, but we injected the length of her scar with the same remedy. And what we found is that within a week, her diarrhea had gone away, that she was down to just a couple bowel movements a day. And she was very much relieved, and she was very happy. She came back about 6 months later saying that it had started up again. We redid the scar, and I hadn't seen her. It's been about 4 years until I ran into her in the health food store, and she said that she was doing perfectly fine. Her diarrhea was gone, and she was cured. So sometimes these reactions are very interesting and very unusual. A scar one place can cause a symptom another place. And so this is one of the things that we test as part of our routine procedure, and when we find it, the remedy is very simple. It works 95 to 99% of the time and can really help a person feel better. So this is one of the things we do here at LifeWorks, is find the causes of the symptoms and problems that people are having, and when we find the cause, we can then get a remedy or a treatment or an intervention that will actually restore the body to its prior health, and that's our goal. You can reach us at www.lifeworkswellnesscenter.com, or you can call our office, 727-466-6789. I hope this has been informative for you. Have a good day.